your questions are Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School, and also Professor Siân Griffiths, an epidemic specialist, epidemiologist and Emeritus Professor of Public Health at the Chinese University of Hong Kong. You are both very welcome as ever, and thank you for joining us again to answer our viewers' questions. The first one from Dave Matthews for you, Dr. Pankhania. Can a GP deliver both types of the vaccine safely? So talking there presumably about the Pfizer-BioNTech and the Oxford-AstraZeneca vaccine.
Yes, of course they can deliver it safely. Having said that, the Oxford-AstraZeneca vaccine is a lot easier to give because of the storage requirements for the Pfizer-BioNTech vaccine to be maintained at -70°C. So difficult to give. Of course, it can be given. The easier one to give is the Oxford-AstraZeneca one.
Which opens up the possibility of it being administered in lots of different settings, not just in hospitals or GP surgeries.
Indeed, and that is the plan, that the Oxford-AstraZeneca vaccine will be given from many, many different portals, including mass vaccination centres, community pharmacies, and of course our GP practices as well.
Professor Griffiths, Wayne on Twitter asks, if the new strain is more transmissible, why has the rule of 2 metres not been extended?
Good morning, Wayne. The 2-metre rule is based on the fact that when you cough and the virus is spread through droplets and aerosol, it goes to about within 2 meters. So you don't need to extend the distance between people. What we need to do is to reinforce the messages about wearing masks, about washing hands, keeping surfaces clean and clear, and also ventilation, keeping windows open where possible and making sure that we're in well-ventilated spaces. If we have that package of measures, it will help to diminish the transmissibility of the vaccine, of the virus.
And also stick to that rule of 2 metres. I mean, in my personal experience, I find a lot of people don't. I'm always going way out of my way to avoid people who don't seem to be sort of doing their bit to keep some distance between me and them. So I think that's a common issue, isn't it?
Keep your distance. It's not 1 metre plus anymore, it's 2 metres.
Absolutely. Dr. Pankhania, again for you now. This is a popular question, this one, and we've got one version of it from Gary Langlands on Twitter. Did the trials that approved the COVID vaccine include testing a 12-week gap between the first and second dose? How can we know this method is safe? That's interesting because, as we mentioned just a few minutes ago, the World Health Organization has said it doesn't recommend following the UK's lead on this.
Yes, so in the phase 1, 2, 3 trials, etc., it was not tested with the 12 weeks or 3 months interval. It was tested at a shorter interval. Having said that, and people like myself have been immunizing for many years, at least 3 decades. So I do know that we never managed to give the second vaccine or the third vaccine at exactly the precise time. And despite that, it still works. So what would I do as a public health doctor in the middle of a crisis? We have a crisis. We have a rising number of cases. We haven't got a large bulk supply of vaccines in one go in our hands. Therefore, the one dose given to many people as fast as possible, as efficiently as possible, creates a number of people who are immune and protected from severe disease. And then we follow it up 3 months later, 12 weeks, and give them the top-up to boost their immunity. So, of course, the WHO, Pfizer, etc. will say, but it's not in our data. Understandable. As a public health measure, I think the United Kingdom government have got it right.
OK, Siân, this is from Giocha in London. Pharmacists give the flu jab every year and dispense medicines. So why are they not giving the Oxford COVID vaccine? This is a story that we're going to be doing more on in the next hour, as pharmaceutical representatives say, look, we are itching to play our part, but we haven't heard anything back yet from the government or NHS. So, you know, why aren't pharmacists so far being involved in this?
I think this is a matter of timing, Annita, because basically this is a new process and it's just getting going. There are also many retired doctors, nurses and others who are willing to come onto the front line to help to vaccinate. But as we've had pointed out to us, these are early days. There are issues about monitoring the initial doses of the vaccine, ensuring the safety. And I'm sure as the supply ramps up and we get better organized to give the vaccine, pharmacists will be at the front line. I can't imagine they won't, because they are such a useful force for giving vaccines under normal circumstances for flu. So I think this is a matter of timing and needing to ramp up the delivery of the vaccination programme.
OK, Nick Ruck on Twitter, Dr. Pankania asks, will we be checked for antibodies for the virus before being vaccinated?
No, and the check is irrelevant, really, because it's not going to really inform us very much about to give or not to give. My advice would be, whether you've had your infection, don't go around wasting money on doing antibody tests. We never do those sort of things. Just get the vaccine. It will protect you. It will boost your immunity if you've had prior infection. No need to do antibody tests.
OK, Keith Macon, Professor Griffiths, I travelled to look after my elderly mum over Christmas. Am I now allowed to return to my own home?
Keith, I don't know if you're in a formal bubble with your mum. If she's a single elderly person on her own, you can form a bubble and you can visit her whenever you need to. And yes, you can return home. I think that the difference this time round with lockdown, we've learned about the need to provide social support, particularly to isolated elderly people, to young mums, and social support within bubbles. So I recommend people look at the guidance on bubbles and work out how they can continue to give support to the vulnerable while staying safe.
OK, the next question is from Logathus, and this is another one that's very popular with our viewers. Dr. Pankania, how do we know which vaccine we will be given, and can I choose?
Well, I think it's a case of be very grateful we've got vaccines, and I assure you they all work. And therefore, if I was given a choice, I would take the first one available. It's pointless shopping around. They all do the job. They work. And as I've said before, the Oxford AstraZeneca one is a lot easier to give for many people at pace. Therefore, don't choose. Just take whatever is given. They all work. Please be assured.
Yeah, I'd be surprised if there was a matter of choice in it in terms of the rollout of the vaccine anyway.
Mm-hmm, indeed.
Siân, this one from Mike Roach, who asks, why are we still not using the Nightingale hospitals?
Mike, I think the answer to this is, again, a logistics issue. We know that many of the many NHS staff also get sick during the winter, and to run the Nightingale hospitals, you need to fully staff them. It's not possible, and the NHS is working within itself with the very sick patients at the current time. I'm sure Nightingale hospitals will be used over the coming months, but maybe not for the sickest patients.
OK, let's try and squeeze in a few more. Bharat, when we receive the vaccine, will we be given any tangible proof that we have done so, asks James MacDonald Kane.
Yes, the short answer is yes. You get a piece of notification that you've been to a vaccination centre. It will also be in your GP records. You can always ask also for a letter from your GP that you have been immunised.
Siân, this from Roger in Buckinghamshire. We're due to complete a sale on my late father's house. Can we travel 2 hours to the house to complete the clear out before the sale?
Yes, house sales can carry on, so that's a legitimate reason for travelling.
OK, Joshua McCready, for you, Dr. Pankania, I am 19 and have no underlying health conditions. When would I be eligible for the vaccine?
It will take a long time. At least be grateful that it will come to you, but it will take a long time. I see it sometimes towards the end of summer, by the time the very young are immunized. Having said that, you never know. If we suddenly get a large supply of vaccines that we can do it at a mass immunization center, it might suddenly become a lot sooner than I thought.
Try to squeeze in two more. Siân from Alan Coltman, can I take my car for a service? We've got lots of questions on car servicing, work and MOTs.
Yeah, garages can stay open. Everyone will be very relieved that in winter you can keep your car safe, you can get your MOT, and that's a legitimate reason for leaving home.
I'm going to throw in one more, which I know you haven't seen. I hope you can answer, so forgive me for doing that. Sue Lim says, like many people in the UK, I am on statins. Is it true that statins can prevent the COVID vaccination from working properly, or is this another piece of misinformation? Dr. Pankania, would you like to take that one?
Yes, happy to. And really, please be assured these vaccines are very specific. They do a job that is induce immunity. Your statins are not going to interfere with your vaccine. Don't worry about it.
Always good to combat misinformation where we can. Professor Griffiths, Dr. Pankania, thank you again so much for answering our questions. And as ever, a big thank you to our viewers for sending those in. We really hope that has helped to clear up some of those queries you have.